oh my gosh, what if it hasn't been treatment-resistant mental illness through all these years? What if it's been the treatment?
Laura Delano spent years, decades as a psychiatry patient. She said her life, her job was being a psychiatry patient and really had very little meaningful quality of life. But she was able to take matters in her own hands and eventually deprescribe, taper off her medications. And it's that personal experience that she has now turned into a nonprofit and in the consulting business and building an entire community to help others understand the role of medications and the place and the way to deprescribe or taper these medications. It's such an important topic within psychiatry. Medications have their place, but are they the end-all be-all treatment for long term? And how do we safely and effectively ask that question and implement strategies to get their lives back? And this is Laura's journey. This is what she did personally and now is giving back to the community. It's such an inspiring story that I hope you really enjoy this interview with Laura Delano. Now, just be warned, she does talk about her personal experience with suicidality and a suicide attempt. So if that is something that is triggering to you, please be aware that we do discuss this. Now, here's the interview with Laura Delano. Please remember, before we get started, this is an interview with a fascinating individual to share her experience and her journey. None of this is medical advice. We're not establishing a provider-patient relationship or giving any medical advice at all. This is simply information for people to learn from and to address with their healthcare team. So please do not make any changes to your lifestyle medications without addressing it with your healthcare team. Laura Delano, thank you so much for joining me at Metabolic Mind.
Thanks for having me, Brett.
Now, as part of this whole interview and discussion, we're going to get into your story and your history and your experiences because there's so much there. But give us the brief, 30-second overview of who you are, and then we'll get into the details.
Sure thing. So I founded a nonprofit organization called Inner Compass Initiative. Our mission is to help people make more informed choices about psychiatric drugs, psychiatric diagnoses, and tapering off psychiatric drugs. And so I'm no longer in the executive director role there. I was for a while. I also have been working as a consultant with individuals and families for about 13 years now around tapering, taper support, helping people find life beyond meds once they're off. And I'm the author of Unshrunk, A Story of Psychiatric Treatment Resistance, which will be published on March 18th, 2025.
Excellent. Well, thank you for that intro. And yeah, so, talking about your nonprofit and the work you're doing now, but it's all rooted in this personal experience going back all the way to when you were an adolescent and a teenager. And, it was well documented in an article in the New Yorker in 2019 that we will link to. So people can read about it, but give us sort of the overview of your experience in the whole psychiatric medicine world and the diagnoses, the medications, the progress or lack of progress. I know it's a very detailed story, but give us sort of the summary of your experience.
Sure. So the quickest way to say it is that I basically grew up psychiatrized is the word I like to use. I spent my teens and 20s going increasingly deeper into the diagnostic paradigm. Originally one diagnosis became two, became three, one medication became two, became three. And it started when I was 13 with basically my parents not knowing what to do with their angry, defiant, self-injuring daughter who had fallen apart rather quickly before their eyes. So I was sent to a therapist. The therapist eventually referred me to a psychiatrist. And this was in the mid-1990s, just as the juvenile bipolar disorder phenomenon was taking off. And I was told that my anger and irritability were symptoms of mania, which is how they differentiated juvenile bipolar disorder from adult bipolar disorder. And that, of course, my despair were symptoms of, and self-injury and all of that were symptoms of depression. That began what was a 13-year journey into basically becoming a professional patient. I resisted at first in high school. I could tell that my struggles were responses to the stressors on my plate, to the environment that I was in. And so I refused initially to accept that there was something wrong with me. I saw my struggles as an important response to the world around me. But by the time I got to Harvard as a freshman, I spun out my freshman fall there. I stopped sleeping. I was doing drugs. I was acting wacky. I was up until, the wee hours of the morning with racing thoughts about the meaninglessness of life. I was still self-injuring. And I eventually grew so desperate for relief from all my struggles that I resigned myself to what I had been told years earlier. And I thought, there must be something wrong with me because I made it to a school like Harvard. I have everything going for me. There's nothing visibly wrong here that should be causing me to be struggling so much. And so it was at that point at age 18 when I was just so desperate for answers and relief that I voluntarily took myself back to the mental health system. And from there until the very end, basically at age 27, my purpose became treatment and being a good patient and taking whatever meds I was told to take, tracking my symptoms. I saw incredible, top doctors at top hospitals. And so my parents and I really took for granted everything we were told because we were able to get me the best care on offer. And with each passing year that I was a good patient, basically, my life just fell progressively more apart. I managed to make it mostly through college, but was struggling all along to the point where I had to take a year off. I had my first hospitalization because I was really suicidal. Managed to finish college, but was really struggling. Moved through my 20s, unable to really work, take care of myself. My physical health was getting progressively worse with each passing year. By the time I was in my mid-20s, I was on 5 medications. I was on an antidepressant, an antipsychotic, a mood stabilizer, a sleep aid, and a benzo. And I was in chronic pain. My weight, I had gained 70 pounds. I couldn't think. I couldn't function socially. All I had was being a patient, basically. That was the only purpose. And at that point, I was told.
Let me interrupt for one second.
Ahead.
I'm sorry because there's a light at the end of the tunnel, obviously, and we're going to get there. But so I don't want to dwell too much. But I want to go back to the way it was documented in the New Yorker and the way you're explaining it. That they put you on Prozac and up the dose, which made you sleepy. So they put you on Provigil to kind of give you more energy, but then you couldn't sleep. So they put you on Ambien. So it seems like it was this cycle of drug upon drug upon drug, and then you were diagnosed with bipolar, but then you were diagnosed with borderline, and that meant more drugs, and it was drug upon drug upon drug. And looking back, so you said you were sort of a professional patient. What do you think the goal of treatment was for your doctors, and what did you think the goal of treatment should be?
Oh, that's a great question. Well, the goal for me was being compliant. I had no vision of a future for myself where I was actually thriving in my life or, working, having a family. By the time I was in my mid-20s, I was so convinced that I was so severely sick that basically my life was about managing my illness, and which basically meant doing what my doctors told me, going to therapy, doing groups, doing, DBT, CBT, but there was no why for it because I believe that, I'm never going to emerge from this. This is all that my life has. So it was almost like I was going through the motions of all of these treatments that were proffered to me, but not ever thinking there was that there was another side beyond it. And I think for my doctors, I obviously don't know what was in their heads, but they were almost all of them were incredibly kind, well-meaning people who really cared about me and wanted to help me. And I think were seeing me through the lens of their largely reductionist training, which basically had them reducing me into lists of symptoms to intervene upon with more meds. And I did have a lot of therapy, and so I was also talking about my struggles and seeing psychiatrists who were also doing therapy work with me. So it wasn't that I was just seeing a psychopharmacologist once a month to get a refill. I was also getting to know my doctors. They were getting to know me, but it was all with this underlying assumption that I had incurable mental illness and that it was getting worse and worse to the point where I was treatment resistant. And so that story, I think, infused the way I was seeing myself and the way my doctors were seeing me as well.
Yeah. So when you're labeled as you are treatment resistant, and gosh, it just seems so deflating. Like you're saying, like, this is my life. And I mean, there are points where it's based on the story where you were just really, going to give up. And tell us about sort of your mindset about that, about being labeled treatment resistant. But then also let's eventually get to, how you got past that and how you saw the light at the end of the tunnel and came through.
Yeah. So by the time I was 25, I'd never been able to hold down a job or live independently for any stretch of time. My days consisted mostly of, if I wasn't, barely holding on a part-time job, I was in a program of some kind, a partial hospital program or outpatient program. And my days were just my life had been reduced to this small fate of managing my illness and being good at getting my treatment. And so I realized, I've poured all these years of my life into this treatment, into being a good patient, into doing what my doctors are telling me will help me, not kill myself, basically. And look where it's gotten me. I am trapped in a body that doesn't feel like mine. I have no friends. I have no purpose. If this is all that's in store for me for the rest of my life, because I'm so sick that this treatment that I've been relying on isn't even going to be able to help me, then what's the point in being alive? And so I realized I can either just be in and out of psych wards and programs for the rest of my life, or I can kill myself. And I ended up choosing the latter. And to this day, I hold that choice with a lot of respect, because my decision to end my life made a lot of sense given the story I was believing about what my life would look like. And of course, the problem was that I was believing in a false story. And so, yeah, when I was 25, that was when I tried to kill myself. And then it took me another couple of years to have what I think of as my kind of wake up from all of that.
Yeah, I really like the way you phrase that, though. The story you were believing, but that was a false story. I mean, clearly, here you are having started a nonprofit, and you were the executive director of that nonprofit, and you're married, and like completely different life. So clearly, the story you were telling yourself of what your future was not true. But how do you know that in the moment, right? And that's what's so difficult and just heartbreaking about the position that you were in, especially when your doctors, like you said, they're so well-meaning, they're so caring, but when their toolkit consists of just a certain number of tools that don't work, like, then what? So now looking back, like, I guess it's a hard question, but like, what do you think could have been done differently, now that you have the hindsight?
That's a great question. I think, of course, to go all the way back to the beginning, if when I was a 13-year-old girl coming up against puberty, against an existential crisis in which I realized I didn't know who I was, I didn't see the greater purpose in my life. I felt programmed to get good grades and be a good athlete, but what was the meaning behind it all? Those were the experiences that got me originally sent to a therapist. And I think what that message, what that action taught me, the message that it sent to me when I was sent to a therapist, was that I was the problem and I needed to be intervened upon. And so I think if I had, whether it was some older girls, maybe a few years older, who'd been through their own crises, or it was just more visible in the cultural milieu around me, that it's actually a really healthy thing to wake up at the onset of puberty and ask yourself, like, who the hell am I? What is this world I'm in? What's the point to being alive? If I had